A record number of drug-related deaths has been recorded in England and Wales as the number of people killed by substances formerly known as legal highs and synthetic opioids continues to rise. The Office for National Statistics, ONS, said 3,744 people, 2,572 men and 1,172 women, were fatally poisoned by both legal and illegal drugs in England and Wales in 2016, 70 more than the previous year and the highest number since comparable statistics began in 1993. About 70% of the deaths were a result of drug misuse, with the highest rate coming in the 40 to 49 age category. Most misuse deaths were accidental, the ONS said, while others were a result of suicide or mental and behavioral disorders caused by drugs. More than half of all deaths involved an opiate, mainly heroin or morphine, followed by antidepressants, benzodiazepine, cocaine, paracetamol, and amphetamines. The number of people dying from cocaine overdoses increased by 16% to 371 last year, mostly men aged between 30 and 49. The crime survey for England and Wales suggested that cocaine is the second most commonly used drug after cannabis, with the National Crime Agency recording a significant increase in purity of both crack and powder cocaine that may partly explain the increase in deaths. The ONS warned of a sharp increase in people dying after taking new psychoactive substances, NPS, which were formerly known as legal highs before being banned. Products that remain available, including synthetic cannabis such as spice and methadone, which emulates speed, were the cause of 123 deaths in 2016. The ONS said 39 people killed had taken NPS drugs that were not banned at the time of their deaths and cautioned it would be several years before statistics show whether the government's blanket ban in May last year will have any effect on deaths. While deaths involving methadone, also known as MCAT, meth and meow meow, decreased to the lowest level since 2012, there is growing concern about the violence linked to the use of synthetic cannabinoids, particularly in prisons. Pete Birkinshaw from Public Health England said most recent overdose deaths linked to heroin mixed with fentanyl happened mainly in Yorkshire and the Humber. Encouragingly, our investigations in other parts of the country suggest we are not seeing the feared sharp increase in overdoses, he added. Most local authorities allow drug services to supply an overdose antidote, naloxone, to heroin users or their families. The highest mortality rate was in the northeast of England, where there were 77.4 drugs deaths per 1 million people, an increase of 13% from 2015. The area with the lowest rate was the East Midlands, where there were 29.1 deaths per 1 million population.